If my patient's having tension before surgery, I would ask them if they'd like to do a cam therapy. And I would do deep breathing exercises in order to help them feel relaxed. So I would ask them to take a deep breath in, hold for a few seconds, and let it go through their mouth. In through the nose and out through the mouth. And I'd have them repeat it about 5 or 6 times, and then see how they feel. So now we're going to do the surgical asepsis. I have my drape, my bowl, my swab, my sponge, my sterile water, and my sterile gloves. With my drape, I'm going to open the packaging, only hold on to the edges that are exposed, and pull back. Take the drape by the corner. I can only touch the outside parameter because an inch all the way around parameter, inch inside, is considered contaminated. And then I would lay it down. So I'm going to do that. Now I'm going to open the bowl. I'm going to take the farthest flap, pull it, take the sides, pull them, and then hold on to the bowl with the side closest to me. And then I'll be sure to secure the corners so they don't touch my sterile field while I drop it onto the sterile field. That did drop 2 inches from the edge, so that's okay. Now I'm going to open my swabs. I take the edges and I pull them down. And be sure not to touch the outside. And then I'm going to hold them at least 4 to 6 inches, 4 inches over the sterile field and drop them. Now I have my sponge. I'll do the same thing as the swabs. Now I'm going to take my water. My water is contaminated on the outside. On the inside it is sterile, and there's sterile water in there. I'm going to hold it 4 inches above the sterile field and gently pour it at an angle and then quickly turn it vertical so that no water drips. I'm going to hold the label to my palm so that the label doesn't get ruined by the water. If any water does spill on the sterile field, it's considered contaminated. And I would have to start over. Okay, now I have my sterile gloves. I open them. The outside is considered contaminated. I open flap farthest to me, and the sides. Now when I do my gloves, I do my dominant hand first, and I only touch the inside. They're folded over, so I only touch the inside that's going to be touching my skin. So I put those on, and I keep my thumb towards my palm so that doesn't catch on anything. I put them in. Then I have my sterile glove on, and I take the lip on the inside of my non-dominant hand and only touch the outside of the glove. And I put my hand in the flap, in the fold, and I put them on like this. And then I can adjust my gloves after they're put on because both of my hands will be sterile. Those over my sleeves of my gown. Okay, now I can touch, I hold my hands like this so that I don't, I keep them in the sterile field, and I be sure not to touch anything. Now that I'm at my sterile field, I can situate things and do my work. Make it ready.